Today's topic is diabetes management. We have with us Dr. Piya Ballani Thakkar, who's a consulting physician and endocrinologist at Bombay Hospital and Research Center. She's also the founder member and honorary secretary of the PCOS Society in India, and I am Aparna. Just a reminder that this does not replace specific medical consultation, so you will still need to get specific advice from your own doctor. How does COVID-19 directly affect health of people with diabetes?
In terms of people with diabetes, the issue is it's not that patients with diabetes will get the infection more than people who do not live with diabetes. But what is different about people with diabetes is that the symptoms might be more extreme, the complications of the infection might be more extreme, and therefore the outcomes for people who then get infected with COVID-19 are going to be much worse in terms of their morbidity and mortality. That is going to be the difficult part. So as a result of which, people with diabetes, the risk of hyperglycemia, hypoglycemia, to the extent of diabetic ketoacidosis, that's like a life-threatening condition that occurs mainly in type 1 diabetes patients, is much, much more.
What precautionary tips would you recommend to people with diabetes?
So undoubtedly today, I think one, maybe I'll call it an essential self-service to people with diabetes, to us who, if we're living with diabetes, is undoubtedly stay in control. So I'm not going to go into the prevention measures, which are for the general population. All of y'all have had more than enough of all of that. But people with diabetes, undoubtedly, don't think about this as if my sugars are roughly around 200, and I don't know why, at least in India, that number of 200 gets stuck in our heads, that if I'm around 200, my diabetes is perfect. Completely untrue. So the one thing that we could do undoubtedly is check your sugars if possible, stay in control, eat well, exercise well, take your medications regularly, and of course, stay in touch with your doctors. That is extremely important. Letting this be just a time where, everybody's chilling, well, don't let the diabetes chill, or otherwise it's going to result in problems.
How should people with diabetes keep their sugar level in control? How does a glucometer help in the process?
So I think that if one is able to afford a glucometer, undoubtedly having a glucometer for anybody with diabetes, whether it's during COVID time or out of COVID time, having a glucometer if you have diabetes, especially for those who have maybe fluctuating glucoses, are on insulin, more elderly, fragile, sick patients, for any other illnesses also, just having a glucometer in general for people with diabetes is a very good idea. And the reason is that today, one of the main goals of diabetes control is to remain in target sugars. Keep your sugars at target throughout the day. So in order to prevent the life-threatening issues of hypoglycemia or to prevent the long-term complications of hyperglycemia, keeping sugars on a day-to-day control is essential. What does that mean? It basically means that we want our pre-meal sugars, whether it is before breakfast or before lunch or before dinner, sugars to remain between 80 to 130, post-meal sugars to remain somewhere between 140 to 180. So just as a general, if my sugars are roughly around 100 before meals, roughly around a 150 after meals, that kind of equates to good sugar. Now this, of course, I'm talking about the general diabetes population. Different goals are meant for different people. So say for some people, we don't mind a little tighter control. For some young, strong people, we don't mind a little, let's say, looser control or tighter control, depending on the person that we're talking about. But keeping sugars within your control, as your doctor has explained to you, is very important. Right. And like you said earlier, Aparna, it's basically going to the lab these days is difficult. And even then, like we all know that today, if we're going to the lab, we get one fasting and a post-meal sugar. And everybody knows on the day they go to the lab, they're on their best behavior, right? You eat a good dinner. You might make sure that your lunch is very, very well carb controlled. And then you go and take your sugars, you get your sugars done, but that's not representative of day-to-day control. So as a result of which, your glucometer is your best tool to guide you to maintaining near target sugars at all times.
How should one maintain a healthy exercise routine?
I'll take that in two parts. The first thing is of stepping out and going for a walk. So I think for me, my mantra is right now, the goal right now is social distancing, stay at home. If that's one thing that's going to prevent us from this blowing up, especially in our country where we just have overstretched resources. We don't want to overwhelm them anymore. Well, let's follow that one thing that we've been asked for, and that's simply to stay at home. Because today, undoubtedly, also today, if I'm stepping into the elevator to even go down for a walk, let's say if it's even within my compound, I'm pressing the elevator button, holding the railings, the handle of the lift, the railings of the staircase, whatever it might be. Today, if a person who has an infection, and like we said, there are asymptomatic carriers, somebody who has an infection has touched these areas, has left the elevator, now you step in, touch that area, never knowing that there was an infected person in there, and then you've touched your eyes, your hands, your face, etc. Well, the chances are there. So today I would say stay at home. That even if it's for the exercise at this point, I would say I'd rather do the stay at home exercise rather than the exercise part of things by going out.
Right.
Where it comes to following my exercise regimen, well, a very simple way of thinking about it is that if you were going for a walk, basically 10,000 steps is basically equal to, so let me start it this way. 1 kilometer is roughly around 1250 to 1500 steps. So 1 kilometer is roughly around 1250 to 1500 steps, which basically means that around 4 kilometers is going to be 5,000 steps. 8 kilometers is going to be 10,000 steps. So if you were on a 10,000 step routine, what you basically need to be doing is 8 kilometers a day. Now, 10,000 steps roughly is going to take you for a moderate intensity walker. It roughly takes around 100 minutes.
Right.
So basically 1 hour, 40 minutes is the amount of walking that we need to do in order to get to that 10,000 step goal. So even if you keep it as 30 minutes a day, 5 days a week, or even right now when we have more amount of time, keeping that 30 minutes a day, I think, is definitely for a person with diabetes going to be helpful in order to keep the waistline a little trim, our gluteus a little exercised, in order to keep that aerobic activity going on as well. I think that much exercise per day is going to keep you in shape.
One more question. Is walking for 30 minutes twice a day on treadmill and 15 minutes of weight enough for 56-year-old diabetic male fasting sugar levels 130 and post-meal 160 by 70?
Post-meal is 160. Okay. So I think if this has been your regular exercise regimen for all of this time, please go ahead. It sounds like an excellent regimen. So I'm not saying that this is the time for people to start off with sudden new regimens. Don't start running on the treadmill where you haven't even been a walker otherwise. So start low, go slow. You can possibly try and work it out that way. But otherwise, if this is a regimen that your body has been used to, it sounds excellent. Please go ahead. 15 minutes of weight training sounds good.
Do you have any recommendations on diet modification during the lockdown?
So with regards to diet, so just 2 days ago, I got a phone call from a patient where the patient tells me that his need for insulin in a day was roughly around 160 units in a day. So this was an extremely insulin resistant guy who was on multiple oral medications with 160 units of insulin a day, a whopping amount for that matter. And suddenly now over this last 1 week, sugars have come down to the 50s, the 60s, etc. Well, spoke to the wife a little better, and the wife tells me, you know what, right now, it's my kitchen. I'm the one who's doing all the food. The junk food has gone out of the window. And therefore, suddenly, when all the vada pavs and the bhel puris have now disappeared, the patient's insulin requirement, I literally decreased his insulin down from 160 down to an 80. And today, now, the patient is on 60 units of insulin a day with good control. And the patient, it's almost become like a revelation. So yes, diet does matter. So today, of course, with regards to diet, if one is able to take this point of time as, let's say, to discover a new me in terms of diet and cut down on sugar, cut down on your refined grains, of course, cut down on starchy vegetables, stick to the non-starchy ones as far as possible, processed foods, if possible, cut down as well. I know a lot of us might have to live out of, tinned foods, etc. So it's in these days and times, we really might not be able to afford to choose. But if one can keep all of that in control, it'll definitely help. One size obviously doesn't fit all. We all come from different ethnic backgrounds. So I can't tell you stop eating the dosas and stop eating, whatever each one's, home cooked meals are. But if one can, live up to one's glycemic goals, lipid goals, blood pressure goals in terms of cutting down salt, cutting down sugar, cutting down the oil, all of that put together, maintaining weight, that is what a good diet would constitute.
How can I deal with numbness in hands and feet?
So basically, one of the main, let's say, long-term complications of diabetes is what we would call the microvascular complications, which are primarily to the eyes, the kidneys, and the nerves. So this tingling, numbness, etc., is very commonly the first presentation of a long time of high diabetes. And as a result of which, people might present with all of these other issues like tingling, numbness, burning, pain, cramps. All of these are the effects of the nerve related, the neuropathy related complications of long-term diabetes. Now,
Right.
for that, undoubtedly, other than controlling sugars tight, because that is the root cause, and therefore that should be the target of management as a first line, good tight diabetes control. Alongside with that, other secondary causes to make sure one keeps corrected: vitamin D adequacy, vitamin B12 adequacy, make sure your thyroid is doing all right, because these are other secondary causes of neuropathies, etc., also, which can be corrected as well. Other than that, there are medications available today with not many side effects, which can be used in order to decrease the neuropathy related complications. For example, you have the gabapentins and the duloxetines. There are some groups of medications that can be used for this purpose, all better done under the guidance of your diabetologist, undoubtedly, because even with these, every medication can have a little, have some sort of side effects as well. So whenever you get in touch with your doctor, do talk to them, because with this kind of thing, I mean, it does turn out to be a troublesome complication otherwise.
How can I manage hypoglycemia?
Hypoglycemia, number one, is defined as a blood sugar of less than 70. How does one recognize it? Well, the body will give you warning signs. Most typically, headache, dizziness, sweating, palpitations, a little fast heartbeat, a little feeling a little hungry, a little. So all of these kind of symptoms, I mean, they're often in amongst us kind of jokingly referred to as feelings of falling in love, because you've got that fast heartbeat going, the sweating, etc. going. But of course, hypoglycemia can't be taken so lightly. For people who experience it, it can be one of the scariest experiences of their life, for that matter. And in very severe cases, might even go down to the extent of having a seizure or getting unconscious for people whose sugars go less than 30. So of course, like I said, the first step with regarding a hypoglycemia is recognizing it. To confirm the hypoglycemia, undoubtedly, if you have a glucometer, check your sugar. If it's less
Right.
than 70, yes, it does define as a hypoglycemia. If you, at that point of time, don't have a glucometer, or you're sure kind of that this is what resembles a hypoglycemia to me, the simplest way of treating a low sugar is with sugar. So simply what you need to do is put 2 spoons of sugar in your mouth, or put some sugar into a glass of water and drink it up. That's kind of the simplest, let's say, homemade remedy. If you have something like Glucon D, jam will do it, honey will do it, juice will do it, a Coke will do it. Make sure it's not a Diet Coke at that time, that's sugar-free, of course, but a regular Coke, undoubtedly, things like that are what's going to help to raise your sugar very fast. Anything which is mixed with fat, let's say your cakes or your chickies or your those laddus, all of these are not the right way to treat a hypoglycemia, because any food substance that has sugar, which is mixed with fat, it takes time for the sugar to rise, for all of this to get absorbed at the level of the stomach lining. So it's
Right.
pure sugar that needs to be taken at that point of time. Once you have that, check your sugar again 15 minutes later. If it starts rising, going above a 90, etc., you know that you're on your way to recovery. And following that, maybe have a glass of milk, 2 slices of bread, something of that sort to maintain your sugar, undoubtedly, as well. So that is
Right.
the way to take care of hypoglycemia. The one thing I will say over here is that when your sugar is low, you've got to sit back and think, why did my sugar go low today? Because that's really the most important thing that we want to try and avoid for the next time. So if today you feel that, yes, my sugar went low because I ate too little, I ate too late, I was not feeling well, so my tummy is upset, or maybe I walked a little more, I exercised a little more than usual, at least if you have a recognizable cause, that's okay, and try and avoid the same cause the next day. But like the patient, like I told you earlier, if you're having recurrent lows, then it is undoubtedly time to contact your doctor, doctor and get an adjustment done to your doses again, because otherwise you're just going to invite the same cycle every single day.
Right, right. So we should be, we should be aware that we are now eating healthier, for instance, as in the case of your patient that you talked
Absolutely.
about, and
Absolutely.
and therefore recognize that. Okay. How can I manage hyperglycemia?
With hyperglycemia, well, I'm sure a lot of people, if they have diabetes over here, might kind of remember when they first started out with diabetes, they probably didn't know that they had diabetes. And
Mm,
the way they first got to know that their sugars were high was possibly when they did their test for some other reason. And in that sheet, then you suddenly get that the sugars are high. And
mm,
the reason for that is because high sugars are often asymptomatic.
mm,
The commonest symptoms of a high sugar just could be excessive urination, and especially more so at night, a little excessive urination, a little excessive thirst, a little excessive hunger. Those are the common signs and symptoms of higher sugar. A little tiredness, a little lethargy, undoubtedly. And
right.
then if the sugars are in a much higher range, and I'm talking about maybe 300 to 400, etc., it might be accompanied with sudden weight loss. So
Mm,
quite often, because people with diabetes are overweight, now their weight starts coming down. They've not been doing anything really much with regards to diet, exercise, and their weight starts falling. And they're
mm,
patting themselves on their back saying, wow, my weight is coming down. But that is the unhealthy weight loss of high diabetes. So remember that if your weight is coming down, it is in fact more so of a sign that the sugars are indeed very much on the higher side. A very good idea at that point to get yourself checked, because ultimately, like I said, the goal of diabetes control is not about today's sugar, because today people, even with a 200 sugar, are feeling absolutely fine. The
mm,
goal of controlling diabetes is to prevent those long-term complications. Eyes
right,
to the extent of blindness, kidneys to the extent of kidney failure, the nerves to the extent of the numbness, the gangrene, the complications of amputations, heart attacks and paralysis. And of
right.
course, at this point of COVID, we're looking not to get into infections with worse outcomes as well.
Are diabetic shoes helpful?
So with diabetic shoes, undoubtedly today, if people have a lot of numbness, what happens is that they are more prone to developing diabetic foot ulcers at the pressure points, as a result of which their tendency towards ulcers, which then can result in deeper infections, ultimately the infection going to the level of the muscle and the bone, that risk undoubtedly keeps on increasing. The diabetic shoes, how they help is basically will map out for you and deliver to you a particular kind of shoe that will take away the load and the pressure from the more susceptible parts of the foot, which are prone to ulceration, such that you maintain
Mm,
your balance while offloading the pressure and therefore prevent foot ulcers, which ultimately lead to a seriously impaired quality of life down the line. So these diabetic shoes undoubtedly very, very useful to prevent the long-term issues of diabetes in terms of ulcers, and therefore, ambulation goes away. All of these issues are minimized with taking on the appropriate footwear.
right. What are your views on telemedicine? What would you advise?
Yeah, and that's a good question. So recently, what has happened? The Medical Council of India was just dissolved, and a board of governors, alongside with the Niti Aayog, has come into, let's say, the decision-making process for these issues. Telemedicine, of course, was kind of fast-forwarded in order to get it into play during these COVID times. So the whole goal over here is that we want to keep patients medically safe, while the doctors also need to be medical legally safe. Now, with a view to that, ultimately, you also have to understand that doctors today, as a doctor, I'm getting bombarded with 200 WhatsApp messages a day.
Mm,
And the patient will then call me and say, Doc, do you remember me? I am Raju Sharma. We met 2 years ago, and now my sugars are 200. And what should I do? And
mm,
I'm sure you remember me.
mm,
I'm sorry, Mr. Sharma. I mean, even my brain, it just can't be. So we also need to keep our advice error free.
mm,
It's primarily for the patient's safety, because today, if I just start saying, Mr. Sharma, take XYZ, and Mr. Sharma is already on some kind of similar medications, it's just not going to work. It's just going to result in more problems rather than safety here. So
mm,
with regards to telemedicine per se, the few things just to kind of briefly outline, it can be done via video, via telephone, via so I said it's left up to the discretion of the doctor to decide what is the best mode of consultation. So
Mm-hmm.
for example, in certain patients, for example, new patients or patients who have a rash that needs to be seen, etc., then a video consultation, of course, is what's going to make sense. So number
Mm.
one, the mode of communication is what needs to be decided by the doctor. The second thing is that the doctor actually has the right, the discretion to decide whether the patient is suitable for a telemedicine consult. Because today, every patient, the patient might sound too sick to the doctor, and the doctor might prefer that the patient go into casualty, go into the emergency room, and get seen by whichever doctor is available rather than doing a telemedicine, which makes the patient more at risk rather than being helpful to the patient. So that's
Right.
where the doctor has the discretion. Number three is that the doctor need to ID themselves to each other very, very clearly. So the patient's details, his name, age, date of birth, sometimes to the extent of Aadhaar card. If it's a minor, the minor does need to be also accompanied by an adult. An ID of the adult also is required. And the doctor needs to ID himself also. The doctor's medical practice, registered MMC number, or whichever state they're practicing from, their registration number always needs to be clearly displayed to the patient as well. Number three is that the patient needs to give consent to the doctor for advising him. So basically, of course, if the patient has sent in reports, sent in old prescriptions, that becomes an implied consent to the doctor that the patient is allowing for the doctor to ask questions to the patient also as well. The prescription, where it comes to that, there are certain substances that cannot be recommended over telemedicine at all. However, for patients who have chronic diseases like diabetes, like hypertension, all of these kind of drugs can be continued by the doctor for a given period of time. So the doctor will tell you for 3 months this can be continued, and those kind
Right.
of prescriptions are okay. It's important that the doctor have a means to maintain confidentiality. The doctor have a means to maintain records of the patient as well is also very important. And like I said over here, if the I know a lot of patients are just happier with a face-to-face consultation, but today, if you feel that things are not in control, use telemedicine if your doctor has that capability. Use the telemedicine and communicate with your doctor rather than waiting for an extra 1, 2, 3, and 4 months to meet the doctor and let things go out of control in the meantime.
And finally, what is your personal advice to all people with diabetes?
No, as a diabetic, like I said, the only additional instruction for people with diabetes is, again, keep your sugars in good control.
Hmm.
Check your sugars if you have the means, take all your medications, eat with discrimination,
Hmm.
exercise as is best possible. There are lots of videos and all of that available today. Find what is your suited kind of exercise. Explore the net for all of these kind of options. Undoubtedly, stay in touch with your doctor, but
Right.
don't kind of say that this is such a break and then use this reason later that because of COVID I wasn't doing XYZ. That's just going to be the wrong excuse. So basically, जिन लोगों को डायबिटीज है, ऐसे नहीं है कि डायबिटीज की वजह से लोगों को ज्यादा कोविड होगा, लेकिन डायबिटीज जिनको है उनको कोविड के जो कॉम्प्लिकेशंस हैं वो ज्यादा जोर से आ सकती हैं, जिसकी वजह से डायबिटीज को बराबर कंट्रोल में रखना बहुत ही अहम है। डायबिटीज को कंट्रोल करने के लिए हमें क्या करना है? बेसिकली हमें खाना बराबर खाना चाहिए। घर में बैठे हैं इसका मतलब नहीं कि घर के चॉकलेट वगैरह सब खत्म करें। जितना हो सके एक्सरसाइज थोड़ा करते जाइए, जो कुछ भी अगर घर पे चल भी सकें। लोगों को बोलती हूँ कि आप घर पे अपने 5000 स्टेप्स काउंट करिए घर पे बस, और इसकी भी जरूरत नहीं है कि आप एक टाइम पे सब वॉकिंग करें। अगर आप चाहें 10-10-10 मिनट 3 टाइम ऐसे ब्रेक लेके भी करेंगे तो भी इट इज ओके।
Hmm.
तो अपना एक्सरसाइज करते जाएं। तीसरी बात, अगर आपके पास मशीन हो चेक करने के लिए, कम से कम चेक करके देखिए कि आपकी शुगर बराबर रेंज में है या नहीं।
Hmm.
रेंज का मतलब क्या होता है? 80 से 130 खाना खाने के पहले, 140 से 180 खाना खाने के बाद। अगर
Hmm.
लोगों की शुगर, और ये मैं ज्यादातर लोगों की बात कह रही हूँ, मैं ऐसे नहीं बोल रही हूँ कि ये टारगेट सब लोगों के लिए नहीं रहेगा ये गोल, लेकिन अगर आपकी शुगर हमेशा 200 वगैरह के ऊपर रह रही है, प्लीज अपने डॉक्टर से बात करिए। अपनी गोलियां, अपने इंसुलिन प्लीज टाइम पे लेते रहिए। क्योंकि इनको मिस करने के साथ, शुगर बढ़ने के साथ हम अपने आप को ज़्यादा रिस्क में डाल रहे हैं। और फाइनली, अगर आपको अपने डॉक्टर के साथ आप संपर्क में हैं, डॉक्टर अगर टेलीमेडिसिन के द्वारा आपके साथ कॉन्टैक्ट में रह सकते हैं, प्लीज़ इसको आप लेट मत करते जाइए। अपने डॉक्टर के साथ संपर्क में रखें, अपने डायबिटीज़ को ठीक रखें, अपने आप को सुरक्षित रखें, डायबिटीज़ के हिसाब से भी और कोविड के हिसाब से भी।
Good. Thank you, Doctor. And I'll just wrap up now. जो just ये slides ऊपर होंगी Facebook पे भी हमारे और YouTube पे भी एक दो दिन बाद ये contacts भी हम डाल देंगे हमारी वेबसाइट पर. And for those of you जिसको योगा करना है और आपको चाहिए कि कौन से आसन करने हैं, तो हमारे and I keep repeating this everything. We do have a blood shortage, so please donate blood. The blood banks are depleting in many cities. All the big cities are having issues, and that affects not just surgeries, but also people with thalassemia who need transfusions on a regular basis. So thank you, everyone. Thank you, Dr. Piya, for taking the time and talking to us about diabetes management.